How do I know if my dog has heartworm disease?
There are tests available through your veterinarian where they can test for a specific protein that is secreted by the adult female heartworm. This protein is called an antigen and is picked up by these tests. So there is an in-hospital test that our hospital will do where we can look for that specific antigen. We could also send blood out to our reference laboratory and they will also be testing for that specific protein secreted by the female heartworm. If we are suspicious that your pet has an active heartworm infection, say they've come up positive on this antigen test, we will probably also recommend doing a NOTS test, which is where we're going to be looking for those circulating microfilaria in their bloodstream.
Are there any physical symptoms I should be watching for?
There are some physical symptoms. It depends on the severity of the infection with the heartworm disease. So the mild phase of the infection may be asymptomatic to where they might have a mild cough. As they progress to a moderate infection, that cough is going to become more prominent. They may show exercise intolerance, lethargy. There may be some harsh lung sounds that are heard by your veterinarian during their physical exam. In the severe form, you're going to have the cough, would be expected by that time, the harsh lung sounds. There may be a heart murmur that's now heard by your veterinarian during a physical exam. They can even have episodes where they pass out because of lack of adequate blood flow to the brain, which is called syncope. And fluid could also start to accumulate in their abdomen, which is called ascites, associated with the right-sided heart failure that can happen with this. The most severe form of heartworm disease produces what's called a caval syndrome, and that's where there is such a large worm burden in the right side of the heart that blood flow is inadequate through those chambers. And now we're going to also start having excessive hemoglobin buildup in the blood and in the urine. Those pets are critical. You only have a couple of days within which to have treatment started on those animals before they are probably going to pass away.